This is my audience. One in every 115 children that are born, they have a congenital heart defect. To put this in perspective, 1 in every 900 children born have Down syndrome, and 1 in every 930 have cleft palate. Congenital heart defect is the most common birth defect among children born. These are all statistics of Marsha Dimes. According to MayoClinic.com, the heart is formed during the first 8 weeks of pregnancy, and this is when congenital heart defects occur. Congenital heart defects are generally by chance, but are also hereditary. This is an important topic because if you are pregnant, planning to have a child, or are going to have grandchildren, these are facts that you need to know. I'm going to focus today on one of the most common congenital heart defects, TGA, or transposition of the great arteries. I'm going to tell you what it is, how it is corrected, and how it has affected my family. First, what is it? According to the American Heart Association, TGA occurs when the aorta and pulmonary artery are switched. This sounds very complicated, but I'm going to show you a few pictures to help you understand. These pictures are courtesy of ScienceDaily.com. This picture is what the heart is meant to look like. The blood flows into the right atrium and right ventricle, and out the pulmonary artery to the lungs, where it receives oxygen. Then the oxygenated blood flows back into the heart through the left atrium and left ventricle, and out through the aorta to the rest of the body. So you're flowing through the right atrium to the right ventricle, out the pulmonary artery to the lungs, and then back into the left atrium, left ventricle, and out to the aorta. This picture shows a heart which has TGA. The aorta and pulmonary artery are switched, so the oxygen-poor blood is never able to enter the lungs and receive oxygen, and the oxygenated blood from the lungs is never able to travel to the rest of the body. So if you look here, the blood flows into the heart, and it just goes in a big circle because these two are switched. So the blood just keeps going in a big circle here, it never gets oxygen, and the blood over here just keeps going to the lungs, so it has all the oxygen. Usually in babies born with TGA, there is an additional heart defect called a ventricle septal defect and or an atrial septal defect, which is a hole between the two chambers of the heart that allows the oxygenated blood from the lungs to mix with the blood from the body and helps the baby function somewhat. And that's what this hole here is and this hole is. So even though the oxygen cannot go, the oxygen just keeps circling in the heart and does not get to the rest of the body, it can flow over through these other defects and mix, so some oxygen does get to the body. Now we know what TGA is, how it is corrected. It is corrected by performing open heart surgery called arterial switch. This is exactly what it sounds like. The doctor opens up the chest and switches the two arteries. This is a lengthy and complex surgery. It lasts between 5 to 6 hours. According to Cincinnati Children's Hospital, it has a 95% success rate. After the arterial heart switch, hopefully the heart will work in normal function and pump oxygen to the body. Last, how has this affected my family? I'm going to speak from my own experience on this, as my family has recently went through this with our own child. Not only do families have to deal with their baby being sick and in the hospital, but they have to deal with other issues also, such as, what could I have done to prevent this, or what did I do to cause this? It is very hard to see your baby laying there helpless and you not being able to help. These are only the things that I felt. I can only imagine what my wife felt. She had a C-section and was only able to see him for a brief second and not able to hold him for 3 days until she was released from the hospital and able to travel to Kansas City 3 days later. When Caden was born, he had trouble breathing. He was transferred to a hospital in Joplin where he was diagnosed with TGA. Later that night, after he was diagnosed, he was transferred to Children's Mercy Hospital in Kansas City. 15 days later, he went into surgery. Like I said earlier, the surgery roughly takes between 5 to 6 hours. Caden's surgery took 11 hours. During the surgery, the nurse came out and told us there was a problem with his arteries, and the surgeon would not be able to correct them, and his heart would not be able to sustain life. 3 hours later, the nurse came out, and she told us that the surgeon was able to correct the problem, and he was out of surgery and taken to pediatric intensive care unit. About 1 a.m., Caden coded. The doctor came in, performed CPR, and got his heart beating again. Here is a picture of Caden right after surgery. He was unconscious for roughly about 6 or 7 days after the surgery, with all the medicine and everything he was on. The next day, he started improving. They closed his chest 7 days later. A week after that, we were able to come home. He saw the cardiologist recently, and besides some narrowing of his vessels, his heart is doing just fine. If those vessels do not start to grow like they should, he might have to have surgery within the next couple of years. There are a few good things. One of the few good things that you learn while going through all this is that there are a lot of giving and caring people out there. For example, the nurses and doctors at Children's Mercy Hospital did everything they could to make sure we had what we needed and we were comfortable and had everything we needed. Ronald McDonald House was great. They allowed us to stay 1 block from the hospital while he was in the hospital. Children's Miracle Network helped pay for some of the expenses that we incurred while we were up there. And there's a congenital heart defect group in Kansas City which gives a care package to the families, which helps ease the burden of the families with a child that has a congenital heart defect. So even among all the chaos and stress of having a child in the hospital, there are lots of people to help and comfort my family. This is Caden Shiloh Stinson. He will be 4 months old tomorrow. Caden means fighter, which is very fitting, because from birth he had to fight for his life. He will always have scars on his chest to remind him of how hard he had to fight the first 4 weeks of his life. These are his scars here. This is where the doctor had to cut him open and go in and fix his heart. And then these 2 little scars here are from tubes that were in there to help with drainage before they closed his chest up. He will not remember the surgery or the pain, but he will always have the scars on his chest to remind himself and us of the pain and suffering the first 4 weeks of his life. Hopefully now you know what TGA is, how it is corrected, and how it has affected my family. Thank you.